The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. My name's Wendy Wheel and I'm the Director of Interface. Welcome to our webinar today on evaluation and monitoring. I'm joined by James Mahon, who's an economist, and James is going to speak to you shortly and he'll do a further introduction about his background. At the moment you can see me, so I'm just saying hello really. I'm going to turn this off shortly because it's quite distracting throughout the webinar, but I thought it's just nice to put a face to a name for those of you that haven't seen me before. So I'll just turn it off now and carry on. So I'd like to start just by saying we're really pleased that we've had a fantastic response. We've got about 30 to 40 people listening at the moment, so thank you very much for listening and tuning in. If you're new to online technology, I'm just going to take a quick moment to explain how it works. Because there's quite a few people dialing in and watching this, you're all muted at the moment, but it doesn't mean that you can't ask questions. If you just have a look at the bottom, you'll see a question or a chat box. Just type your questions in there as they occur to you. I'll be collating them while James is talking. And I'll either ask them, if there's lots of questions, I'll ask them. If you're keen to be unmuted and ask the question yourself, I will do that as well, because I've got control of the mute buttons for you. So please do ask questions as they occur to you. And just to let you know, if you've got colleagues that wanted to attend today but haven't been able to for any reason, we're recording the webinar, so we'll be able to send it to those people afterwards. So for those of you that don't know anything about Interface, just a quick whiz over, we provide national specialist expertise around working with vulnerable children and families. So it's quite a sort of niche area that we're working in. And so we help local authorities in the voluntary sector plan, design, implement, improve, and obviously evaluate, which is what we're talking about today. And we do a lot of work around children's centres, early years, early help, troubled families, social care, all those sorts of things. And we actually started off from the Families at Risk Division in the Department for Education. So we were a delivery team for the Think Family reforms and setting up family intervention projects across the country. And that's where I met James, because we also did some family pathfinders with local authorities, and James provided the economic evaluation through an external company for us, and James has been with us ever since. So we're trying to enhance capacity and expertise across local areas, and we provide strategic design and implementation. So these are the sorts of things we've done. We do a lot of training. Training is probably about 70% of our work, but obviously we're not here to talk to you about that today, but it just gives you a quick flavour of the sorts of things that we do if you haven't heard of us. So today we wanted to talk to you about how we think that we can support you, just to give you some few tips and things to think about when considering evaluation and monitoring your services. And that's because we've worked with probably about 30 local authorities across the country trying to look at how to respond to phase 2, how to look at early help, and basically to think about what works, how it works, what are the defining principles, and more recently economic evaluation, because obviously it's really important for you to be able to demonstrate in terms of a business case the savings, and James will be talking about that later. So we know that you need to present a business case to continue investment for projects, and certainly those in the voluntary sector are wanting to be recommissioned, so are looking also to demonstrate impact and outcomes. So we're going to consider the challenges in meeting that demand and provide our reflections and tips for you on the best way to approach it. So today we're going to be considering what to consider when you're creating a business case, really thinking about the audience who's going to be making the financial decisions and any decision going forward, so understanding your partners and who's putting money into the pot. And then importantly, collecting and identifying the relevant evidence that's going to give you what you need at the end of it. So I'm now going to hand over to James, and I can see there's a couple of questions coming in already, so I'll be answering those shortly if I can online. And now I'll hand over to James, so over to you, James.
Okay, thank you, Wendy. Before I begin, I think it's useful to give a little background to myself and also make any apologies to anybody who heard this presentation last year. It has changed a little bit, but not hugely. Okay, so I'm an economist primarily. I work in health and social care and education. I'm quite unusual, I think, in that I work across all those fields. the remit of work that I do ranges from building and actually now evaluating economic models put forward by pharmaceutical manufacturers, through to social return on investment analyses for charities and local authorities, through to economic evaluation of educational and social care initiatives such as the Family Pathfinder and Think Family and Thriving Family programs. I suppose what I've done that's most relevant to this, although there's very many things I suppose, is and where this all started with the Family Pathfinders. I was the economist who was part of the team employed by the Department for Children, School and Families, as it was at the time, to undertake the economic analysis of the Think Family Pathfinders. And from that, I think I've been involved directly and indirectly in probably a dozen other evaluations of family-orientated integrated work. Now, what I wanted to do is give you some idea of the landscape as I see it as an evaluator and as an economist. Some of the challenges I think there are in doing economic evaluation in this area and ultimately building a business case. Now, the first and perhaps most important thing I think about doing evaluation in this area and getting it right from the outset is to understand your partners. Now, by partners in this case, I actually mean the people you're actually doing the evaluation for. We do evaluations to influence decision makers ultimately. And perhaps influence is a strong word, but often it is influence rather than help them make the right decision. We've got to understand who they are. We've got to understand what their priorities are and what their budget constraints are. And also importantly, how engaged they are. You know, have they previously funded this sort of program? Are they aware of the agenda? Are they aware of any existing evidence? It's really important, I think, if we don't get that right, if we don't understand what the priorities are of the people that the evaluation is going to be provided for, then there's a danger that however good the evidence gathering is, however sophisticated we try to do our analysis, if it doesn't meet the needs of the partners that we're trying to write this evaluation for, it's going to be of limited value. So who could the potential partners be? Well, I'm going to put a list here just because, you know, it's nice to have a think about who's the usual suspects, and it's interesting looking back at this now, even though this was, like I say, a similar presentation was done a year ago, how it's changed a little bit in some of the projects I've worked with over the past 12 months. And by changed, I mean health have actually got increasingly on board as joint funding partners in a number of areas, and that's quite interesting because it's actually opened up the door to accessing health data in a way that we weren't able to in the past. Where there's still some lack of funding but could still be quite interesting partners are the acute trusts. So yes, CCGs have got involved and some community health trusts, yeah, this is great, but acute trusts, getting funding out to them or getting them to be partners even in a family-oriented project is actually quite tricky. But actually the acute trusts are potentially quite massive beneficiaries from such a programme because often troubled families and individuals in the troubled families will be rolling up at A&E quite a lot, and we all know the pressures that A&E are under. So if a business case can be made to the acute trust that actually are able to cut demand on A&E services by dealing with people more appropriately in primary care, by getting them to access primary care services, by resolving some of the chaos in their lives, then that's actually quite a compelling case, I think, for acute trusts. And also charities, I think there's potential there to get involved, charities involved as potential funding partners and using local authority and other funding to leverage investment out of charities. So what sort of evidence will we be looking for in a business case? Well, there's economic evidence, of course, and that's primarily what I'm going to be talking to you about. But is economic evidence the same as cashable savings? Well, no. And ultimately, all an economic assessment is, and I'm going to say all, and then use quite a flowery sentence after this, but all it is about assessing whether a change in outcomes from an activity is commensurate with the change in resources deployed. So, you know, essentially, is what we're putting into a project worth what we're getting out of it? Now, you may have evidence of this now, or you may have to put plans in place to collect this evidence either to support an ongoing funding arrangement or to gain funding in the future. But ultimately, that's what the assessment is, and that's what the decision maker has to decide. Is the resource we're giving to this project worth what we're getting out of it? Now, there are many ways that we can look to do this, but we think it's important for partners in terms of the changes they're interested in to identify those. What are your partners interested in, and what standard of evidence on these changes will they want to see? So, for example, if you're looking at, to take NICE as an example, the National Institute of Health and Clinical Excellence, I'm doing work for them, they're very explicit about the sort of evidence they're expecting to see and how that evidence is going to be drawn. And there's no reason why that we can't have similar conversations with the partners that we're going to be doing the evaluation for to find out what sort of evidence they want to see, what sort of evidence is going to be compelling. So, for example, your service might be effective at getting people to access mental health services. And that might be, you think, oh yeah, the local CCG might be really interested in that. But maybe the local CCG is more interested in reducing demands on GP practices through unnecessary attendance. Now, those two things might be linked. But if the only metric that you're collecting is on accessing mental health services and not on accessing GP practices, then you're not providing the information they want. So it goes back to being a bit flexible on who you're working with and the partners that are being involved, and making sure you're flexible to their needs in terms of what they're wanting and the standard of evidence that they'll accept. So when we're saying about what sort of evidence is acceptable, in our experience, the level of evidence to make a decision is required is different across the public sector, across public, private and charitable sectors. And so taking NICE, for example, again, you know, they want randomised controlled trials. Although interestingly, the demand for randomised controlled trials, even within NICE, is diminishing. On the other hand, some people might find good case study evidence describing a family's journey to be really convincing. So, for example, charities, even local authorities can find that sort of stuff very compelling. So as part of a business case, which looks to the future for continued or potential funding in the future, then once you've established what matters and what evidence will be acceptable, it's best to establish what success is a priori. So a priori is, I'm sorry, that's the economist in me, just means before you start doing things. So the key word to remember is commensurate. So we've said that resources deployed have got to be commensurate with the outcomes seen. So that's got to be determined beforehand too. So it's important that the success criteria is how the project's going to be determined as success is determined before you actually start the evaluation with the partners, so you'll know at the end what success actually looks like. So when we come to collecting the evidence, I don't want to leave the idea of getting appropriate evidence for different partners behind. Just because a health partner says that they want to see a randomised trial does not mean that you try to do one. And I've had this in the past frequently, where health want to get involved, and health are used to dealing in a world where the gold standard of evidence is a randomised controlled trial, and that's what must be done. If not a randomised controlled trial, then some sort of randomised trial. But actually that's really, really difficult to do in the sort of family-focused work that we're talking about here. So what needs to happen is to explore what's feasible, and if the ideal can't be achieved, then how can what be achieved be done and presented in a way that will be sufficient for the partners. So again, it comes back to this, keeping the partners in the loop about the evaluation all the way through the process, but at the start saying this is what we'll be able to do, this is the quality of evidence that we'll get. We understand that ordinarily might be the standard of evidence that you'd want to make a decision. How can we collect it in such a way that it's as robust as it can possibly be and still be informative to you, even though it doesn't meet the gold standard that you're wanting? So the evidence that's required for an economic assessment ultimately is an evidence on effectiveness of change. Now, it may be that you're already collecting some data on families, such as that required by the DCLG, or just being collected internally. Now, that could be sufficient to meet the needs of some or all the partners already. Or it could be that it's possible to modify what's being collected slightly, perhaps by adding in an indicator here or there, or altering the way a particular change is being collected if it's not being collected in quite a robust enough way for partners. Or we could retrospectively look at existing data in a different way. And I'm always in the path of sort of least resistance with data collection and not collecting data, new data that doesn't have a good use. So not introducing new data collection just because we think it would be a good idea. There's got to be a real strong rationale of why we need that data and why it's got to be collected in a particular way. So could an external evaluator help? Well, as an external evaluator, it's tempting to always say, well, yes, of course, it's always going to help you for an external evaluator. But actually, let's look what an external evaluator can do. I mean, what we can do is provide a level of independence that may be requested by some funding partners, and we're actually going through a process of this with a project that we're working on currently, where effectively it's been evaluated internally and we've been asked to independently verify the evaluation that's being done. And that's actually a very good use of resource, because it's a less costly way to bring in external help while still maintaining the level of independence, and so therefore reliability and removal of bias from results, which some partners are going to demand. But it's also a resource. You've got to remember that if you spend on external evaluation, that could be directed to families, and this has always got to be kept in mind. So in our view, evaluation costs, external evaluation costs, should always be kept to a minimum for what is required for the people that are going to be making the decisions. So it's going back to the partners again. In our experience, much of the nuts and bolts of an evaluation can be kept in-house in any case. But you need to ask whether an evaluation is required at all. I sort of sound like I'm talking out the requirement for us at all, but actually, you know, you have to be serious. Your success criteria have been decided beforehand, and you've got evidence gathering in place, and there's confidence in how that's been collected, and the partners are happy that it doesn't need to be externally evaluated or externally verified, and you've got the capacity in-house to analyse the data, then maybe it's best not to bring in somebody external and save your money. I mean, I think Wendy would completely agree with me on this. I mean, the interface very much has been set up to try to improve life chances for families, and part of that, and as an economist, I don't want to see resource deployed on external consultants that could be spent making things better for families, providing direct frontline support to them. But equally, sometimes there are occasions where that is resource on evaluation that's well spent to improve the service, make sure the right decisions are made about that service, because ultimately that also will result in the better outcomes for families. Now, as far as economic assessment goes, we have a following mantra, which is evaluate what can be valued, and by value we mean put a monetary value on what can be valued, and then we measure what can't be valued, and then we describe what can't be measured. Now, if you can monetize a change, then by all means do, but recognize that this is not the same as a cashflow saving. I mean, I've been tapping this line now for so many years, I've sounded like a broken record to myself, but a monetized change, a monetized saving, is not the same as a cashflow saving. So, for example, if you can show you've reduced demand on social workers with the families that you're working with, and you've reduced the monthly demand from each family from 4 visits a month to 1 visit a month, and the cost of a visit is £120, and you've costed all this out, and you said, well, there you go, we've reduced costs, social work costs per family by £360 per month, so that's £360 we can cash by cutting the number of social workers. Ignoring the fact that demand for social workers is so high that actually what you've done is you've freed up the social worker to go and meet the other million other things that they've got to do with their time that they weren't able to do, and cut waiting lists and all sorts of things. You're not able to release resource just because you've reduced demand. In some cases you can, but they are quite rare. So yes, other things you can monetize, don't necessarily equate monetization with cash flow savings. For things you can't monetize, then make sure you measure the change well. So you quantify the change. You've cut the demand for social workers by 75%. Excellent. Finally, some of the most important changes you can see with families, and I know this when you read through copious case files trying to pull out change, which I have done, some of the most important changes you just can't measure quantifiably. But you've got to try to think how they can still be captured consistently. So some thoughts on collecting the evidence above what we just talked about. There's an interesting challenge for evidence collection on change where projects where intervention is genuinely early. Now, there may have been little resource used prior to engagement and little evidence of poor outcomes. It is early intervention. By nature of it being early intervention or prevention, there's very little poor outcome that you can say we've managed to change. You're trying to prevent the poor outcome happening or developing further. So therefore, the ability to show change is limited. And then you've got to be open about this with partners. and talk with them about the sort of evidence on change for these families that can be presented, and think about how this might link to longer term outcomes that they might be of interest to them. Now, I'd love to say there was some sort of magic bullet to this, because if there was, I probably wouldn't be giving this seminar today, and I would be sat on my yacht somewhere, because anybody who can come up with the magic solution of how we get this direct linkage between genuinely early intervention to a monetised saving in the future, or even a definitive positive long-term outcome, is sat on a little gold mine, because it's very, very difficult to do. However, that doesn't mean we don't try to explain the picture, we don't try to explain change. And some of these things can be softer measures of the family star, for example, or some sort of family well-being questionnaire. So we can start to point to family function improving in the short term, and conceptually link that to what future outcomes might look like. Again, it's about making sure you've talked to your partners beforehand to make sure they're happy with that sort of approach. Now, I can't stress enough the importance of getting practitioners and managers on board if a new data collection is required. Now, I've stated that if at all possible we don't collect any data that's not necessary, but in some cases data is required to be collected above and beyond what is routinely collected anyway for the purposes of the evaluation. If that's the case, then managing practitioners have to be on board on why that is required. If they are not on board, then any data collection and therefore any evaluation based on that data is doomed to failure. I can't put it I can't put it firmly enough how important that is. Now, there are a few paths to avoid if at all possible. If randomised controlled trials are not possible, and let's be fair, they never are, then some people want to see a comparator cohort as a counterfactual. Now, it's interesting, I'm thinking in the past 12 months, maybe even the past 2 years, the demand for a comparator cohort has perhaps fallen a little bit, and people are just interested in sort of doing before and after studies, but it's still there. Now, there can be a tendency when people say they want a comparator cohort and you go away and get one, to put too much weight on the results of a comparator cohort analysis. That's, well, from a cohort that's not necessarily that comparable to the families receiving the intervention. When you look at a selection of families that are supported in a troubled families type approach, they're very, very different within themselves. They can have very different problems. Some are suffering from criminality, some from truancy, some from mental health problems, some all three. It's a very dispersed, very wide-ranging set of problems that families face. And so the cohort you're working with is very heterogeneous. To find a comparator cohort that's similar is going to be really, really, really difficult. So any comparator analysis that has undertaken has to make sure that any bias within the comparator is fully understood by everybody before the analysis findings. So you explain this to your partner. If your partner demands, no, we want to see how this, we want some sort of comparator analysis so that we know that the changes that you see are actually real and wouldn't happen anyway. And say, so okay, we can do this comparator, but you've got to understand that in building it, this is the closest comparator we can get, but it's still not that close for X, Y, and Z reasons. And because of that, we might expect these families that we've got, their outcomes to be moving in a certain direction towards or away the outcomes that are being achieved for the families that we're working with. Now, as an economist, I think it surprises people when I say this, but don't devalue qualitative data as a means of providing economic evidence. Qualitative data is actually excellent for describing why things have happened, so it can actually form the basis of what we call a narrative counterfactual. So it can be used to understand the scale of changes seen and how likely they are to persist. So what do those two things mean when I said it can form the basis of a narrative counterfactual and also that it can help us understand the scale of changes seen? Well, a narrative counterfactual is the family themselves saying, we've seen these changes happen in ourselves. Yes, they've happened. Criminality's fallen. My children now attending school. I'm getting help from my mental health practitioner, which I wasn't getting before. So I'm not going to my GP all the time. So we've seen these changes. And then the family says, if it wasn't for the troubled families team coming in and helping, and my key worker coming in and helping me in X, Y, Z reasons, these changes would not have happened. So the family are giving you the counterfactual. The family are telling you what would have happened if they hadn't been supported. And that can actually be very powerful. Of course, it's potential bias in what the family is saying, but that's fine. There's potential bias in every piece of evidence that we ever collect. As long as we understand that and include it in our analysis and in our description of findings, that's absolutely fine. And again, when I said it helps us, qualitative data helps us understand the scale of changes seen and how likely they are to persist, that's because the family can also tell us how their lives have changed, and from that you can infer whether that change is likely to persist into the future or not. Now, so don't be ashamed to big up the value of case study analysis, case study analysis being predominantly qualitative often, for examples of evidence for partners to consider. And actually what can be very nice is what we call a costed case study, where you have a mixture of qualitative and quantitative data, where you describe the family's journey, what was going on in the past, what happened whilst the key worker was working with them, and then what's happened afterwards. So there's a nice description there, but in that you put actual quantitative and monetary values against the sort of things they were experiencing. So if, for example, they say, oh, you know, in the year before the key worker got involved, my son was actually arrested by the police 5 times, 4 times for assault, you can put costs to those things and you include it in your case study. And again, that can be something particularly powerful, but you've got to make sure that sort of approach would be informative to the partners, the decision makers who are going to use the evaluatory evidence, who are going to use the evidence in the business case and look at the business case to decide whether or how to continue funding a particular program. Finally, evidence on effectiveness is one thing. Don't forget to fully understand your costs of delivery. Really important in a business case and in evaluation, economic evaluation, to understand how much it's actually costing to do what you're doing. Sometimes that's not as transparent as it should be, but although it's at the end of this particular part, really, if you've not got a good handle on the costs of the project and what parts of what you think is fair for partners to contribute, then your business case is going to be a little bit lost. So I'm going to talk a little bit now specifically about cost-effectiveness evaluation and economic evaluation, and the cost-effectiveness question. Now, the cost-effectiveness question is part of every evaluation. Now, it might be phrased in many different ways. They might say that we're wanting to do an economic evaluation, we're wanting to do a value for money assessment, but it's been increasingly important, perhaps the highest evaluation priority over the past 5 years. So how should we address it? Well, as an economist, when people say cost effectiveness to me or economic evaluation, what do we mean? Well, we have all these different phrases flying around: economic evaluation, economic analysis, explore the cost effectiveness, show cash-flow savings. At the end of all this, when people put things like that in and what people want in a business case, are they really wanting to see, does this save money? Or are they actually saying what I'm wanting them to say, which is, are the resources deployed commensurate with the outcomes seen? We need to be very precise when posing the economic question. This is precise when we're building the business case, and precise again when we're having those conversations with the partners right at the start, what they're wanting in terms of an economic evaluation. What do they mean? Do they mean, are we saving money? Or do they mean, are we actually getting enough bang for the buck, if you like, from the money that we're spending? So we've got to ask the right questions. Decision makers, again, have to be involved from the outset. You've got to establish and agree the critical questions that need to be answered. And if a question will make no difference to a decision, then don't ask it. Now that might seem a very strange thing to say, but I've been involved in enough evaluations where part of the evaluation has been to answer a specific research question, and it very quickly becomes apparent that this research question is just actually not that important. It isn't going to influence decision making at all. So if it's not important, don't ask it. But don't avoid asking the questions that do matter. Even if you think the answer is very hard to evidence, it's always better to have poor evidence on a question that matters than proof against a question that doesn't. If you're a decision maker, you would rather have some evidence on something that matters to your decision than a ton of evidence on something that isn't going to influence your decision one way or another. I suppose another way of phrasing this or thinking about it is there's a tendency sometimes to collect what can be collected rather than collect what matters in terms of data. And we just go, oh, well, that can't be collected, so we're not going to do it. Well, you know, there's sometimes something genuinely you can't get any information on at all, but often we can get proxies, we can get some indication. And if we just collect the things that we can collect, we can then overemphasize the things that don't actually make any difference. Okay, so I've talked a little bit about this before, but it's about setting the success criteria and satisfactory evidence parameters. Now, very much, as we said, before the evaluation starts, we've got to establish a whole load of things with partners. One of the things is, what does effective mean? Not only in terms of measure, but what level of effectiveness is going to be meaningful. Now, I've talked about NICE a little bit, and I don't know how aware anybody is of how NICE operates, but they're explicit about what they mean by effective and cost effective, and where that line is drawn. There's no reason why that can't be set explicitly before an evaluation starts as well. In fact, it should be. It could be that it's as simple as, the success criteria is simple as, this way of working has to be at least as successful as the previous way of working. So that's the success criteria. Just has to be at least as successful as it was before. Now, the reason why that could be the case is that they're actually deploying, the project that's been put in place is designed to spend less resource. So if you can spend less resource helping these families and deliver outcomes that were at least seen as what we've seen before, then you'll go, well, okay, cost less, outcomes are the same as they were before, so therefore it's going to be considered cost effective and worth funding. Now, we have to try to look at the total impact across everyone impacted by the intervention. If an intervention is redirecting resource from one client group to another, then we can't ignore the cost to the group that has lost resource. And I've seen this frequently happen, where what an authority has done is they said, right, we're going to do some sort of targeted family work. Excellent. And we're going to fund it because these are really problematic families and they're costing us a lot of money. This is grand. And we're going to fund it by taking resource away from families further down the chain, if you like, families that aren't so, don't have such entrenched problems. So they're not going to have any funding now, or the resource that they were receiving is going to be greatly diminished. Now, if that's the case, there's obviously a cost to those individuals that now have reduced service, and they cannot be ignored. Now, it might be very difficult to gather evidence on them, and the best you might be able to do is, when you describe in your business case or in the evaluation about the change in resource deployment that this particular project has brought about, that you describe what it has meant elsewhere in the authority to other client groups. But like I say, don't just ignore them, because there is a cost that's borne to them. Unless it's genuine new money and it's all new funding and nobody's having to miss out anywhere because there's been no redirection of funding, then we don't have to worry about that group. But in reality, I think in most cases there's been some redeployment of funds. Yeah. So again, it was just a final point about decision makers have to decide before the evaluation what types of evidence they'll find sufficient to inform their decisions. I mean, a lot of this gets a little bit repetitive, but actually it's repetition for emphasis, and always going back to looking at what your decision makers want. So what sort of economic analysis can we do? Now, this goes a little bit off tangent a little bit, but I think is quite interesting. There are actually a range of different economic analyses that we can employ. Cost-consequence analysis, where we just sort of look at all the costs that have been incurred, we look at the outcomes that are there, we don't synthesize them in any joint way, we just say, here's your costs, here's your benefits, oh decision maker, do you think this is worth it or not? A cost-effectiveness analysis looks at a cost per particular unit of outcome achieved, so you might have a cost per crime avoided, cost per person put back to school, cost per life saved in an extreme situation. We have cost-benefit. Now, SROI, social return on investment, is a form of cost-benefit analysis. There, we put a monetary value on all costs, put a monetary value on all benefits, and we say, what does the balance look like? And if you've got a positive return, we tend to say that that means that it's cost-effective. However, I think that it's a very complicated situation, that, and not as simple as it first might seem. I see a lot of SROIs done where they'll report £40 saved for every pound spent, and I sort of scratch my head, look at the numbers and think, not quite so convinced about that. I think SROI only really works when it's constrained by sensible proxies and time horizons. So you use sensible values and you don't say, and the change we've seen will be seen for the next 40 years, and so we're going to claim 40 years worth of savings. I like to constrain my SROIs effectively to be about 12 months and say, what do we save over 12 months, maybe 2 years, which means that my SROI ratios tend to be much lower, between about £1.50 and £2.50 on average for every pound saved, but sometimes you find the SROI ratios are below a pound saved for every pound spent. But that doesn't necessarily mean that the project shouldn't be funded. It depends what the primary objective was. If the primary objective only was to generate social benefit that could be valued at a greater value than the money that you're spending on it, then fine. But often things where we're doing SROI, there's a greater social good that is difficult, so difficult to value monetarily that it can't be. And so then the SROI has to be broader and say, well, okay, you do seem to save a little bit of money. There's some social gain that we can put a value to. But there's a range of other benefits that the decision maker is interested in too, and this is how the project has performed against them. This cost utility analysis, which NICE uses, which I'm not going to bore you with here because it's not relevant, we'll never be doing it in this sort of work with families. In our experience, cost consequence and some CBA is useful and doable with family work. Cost effectiveness analysis could be used when comparing different interventions, but I've never actually been able to do it. CBA in theory can lead to cashable savings, but in practice, like I've talked about, it's very difficult to make a case for this, and at best sort of shows potential savings or what the opportunity cost is. So I'm going to talk a little bit about collecting evidence, and we've talked a little bit about RCTs, randomised controlled trials. Now these are seen as the gold standard, but they're not without problems. There's a lot of debate actually in the literature about their appropriateness in social interventions at all. Now in past tenders have explicitly excluded the use of RCTs. Some actually have explicitly stated that we should be doing RCTs in evaluation. We've said nope. But work in American over here shows that there may be scope for some use in limited circumstances. I suppose I've put this in because we should keep an open mind that there may be some instances where somebody asks for an RCT, decision makers asked for one, and there may be some scope to explore whether that was possible, and in some very rare instances we might find it is. But in 15, 16, 17 years of doing this, I've never come across an RCT, a good RCT, with family-focused work with troubled families. So what does that leave us with? Well, there are other sources. What's possible? We've talked about comparator cohorts. They can be more trouble than they're worth, to be honest. There are cohort studies, retrospective and prospective, so we're just looking backwards and forwards at a particular cohort of families. Now this is what we do most of the time, to be honest. We look at the families that are being engaged with through troubled families work, through a key worker service, and then we look at how they've changed and how they change over the period that they're worked with. We can do costing tools for resource use for both benefits and outcomes, to try to value the outcomes that families are experiencing, but also the resource use that's been involved in supporting the family. There's always going to be limitations. There's a time frame for collecting data. We are working with families often, or rather yourselves are working with families, or your practitioners are, who've got very entrenched problems that are going to take many years to sort out. So the time frame for collecting data is always going to be a limitation. And there's always going to be the potential, as there is for anything. I've seen some RCTs that have been very well set up in a hospital setting, completely blinded, and bias and confounding is coming. There's always the potential for bias and confounding. The important thing is to recognise it if at all possible, try to mitigate for it, and try to incorporate what it might mean in your analysis. And finally, of course, like I said before, please don't undervalue qualitative research. Good value, good, well-conducted qualitative research is at least the equal of good value, well-conducted quantitative research. So once we've collected all the evidence, we've worked with our partners to find out what they wanted and what should be collected and how it should be collected. We come to presenting the evidence. We've done all our analysis, this is grand. In our experience, the presentation of the evidence is as important as everything else that's gone before. right at the start, as well as establishing what needs to be collected with your partners, what evidence are going to find compelling, blah, blah, blah. Also find out how they want the evidence presented. What units, what metrics are going to be important for them? Is it by individual? Is it by family? What unit costs are going to be interesting for them? How they want those unit costs presenting? The unit costs of delivery themselves are often very informative. I think it surprised me sometimes how much can be spent on an individual family whilst they're being supported. Now, that's not to say that that money wasn't well spent, but that in itself can be informative, just establishing what the unit costs of delivery are. Sometimes we've got to use very simple, often very simple, economic modelling to synthesize disparate evidence and to plug data gaps and to test assumptions. So this might be the case where we're trying to, for early intervention, trying to link findings we're seeing in early intervention and changes in family well-being to longer-term outcomes. And so it's important we do economic modelling so that we can link those things, but also then to test any assumptions we've had to make that linkage. And then to return to the original questions and the success criteria, ultimately, in the presentation, say, well, this is what the questions we're trying to answer. These are the questions you wanted answering. These are the success criteria that have been set, and this is the evidence we have against that success criteria. So, in summary, cost effectiveness has increased in its importance and is likely to increase in time over in its importance. It's interesting, actually. I wrote this last year, and I don't know if I've revised my view on this a little bit. In the sense that, yes, cost effectiveness evidence and asking for economic analysis has remained as popular as it was last year, but actually I've seen just a couple of projects that we've been involved in where, I don't know if we use the word sophisticated, and becoming more sophisticated is the right phrase, or just there's been a change in emphasis from showing cost effectiveness to showing change in resource use, and understanding that actually what we're interested in is how the demand on public services changes when we get involved with these families. So it's understanding things like, actually we've found when we go into families, we're actually finding some unmet need, potentially significant unmet need. That means that the demand for child protection services rises when key workers get involved, or more children in need get found, or mental health services and GP practice visits actually increase, but acute visits decline. And it's understanding that pattern of resource use that, like I say, that's been requested in a couple of pieces of work over the past 12 months. And I actually find that it makes me very happy, because I think they're very important questions to ask. It's moving away from thinking, does it save money? Are there cash flow savings? And actually it's decision makers becoming more realistic about this and just trying to understand, well, okay, how's it going to change the demands on different services if we work like this? So where we don't have to deploy our resource more. It's important to establish as much as possible in terms of the decision-making rules a priori. I've hammered on about this for the past 30 minutes. Try to establish as much as you can with decision makers before you even start. Be very realistic with them and with yourselves, but not pessimistic about the data that can be collected on costs and effectiveness. Remember that quantitative data is not the only evidence that you can use for economic evaluation, and qualitative data can be just as useful. And don't lose sight that economic evaluation and your business case can only help decision makers make decisions. It does not make decisions for them. And this is another one of my pet mantras. It is not my job or your job as evaluators or your job as people presenting a business case to make the decision for the decision maker. It's just to present them with the evidence that they require so that they can make the decision. I think it's important not to lose sight of that, because sometimes it feels like we're wanting to give a definite answer. Yes, this should be funded, or no, it shouldn't be funded. When actually, if we take a step back and say, no, it's just our responsibility to make sure that the evidence we present can help decision makers make that decision. It makes our lives not necessarily easier, but helps with the focus of the work that we're trying to do. So you've got to identify and understand your local partners' needs and priorities. Again, we've said this again and again and again. Don't get hung up on cash flow savings. and be confident tackling this with partners. And by tackling, I mean saying, listen, you might want cash flow savings, but realistically, you're not going to get there in most cases. Unless of course you can think of a way for a particular service or a particular project where you think, yeah, this will definitely generate a cash flow saving. Talk to partners about all the evidence, economic, quantitative and qualitative, that will convince them of the worth of investing today and for this to be a priority for investment in the future. And then put strategies to gather this data and make sure staff understand the importance of the collection. And finally, although I've said that, we're not always going to be required and we'll always try to minimise our involvement from a resource use perspective, Interface, of course, are always here to help in whatever capacity that you might need us to. So thank you very much for your time. I hope that was of some use. I do have a tendency to ramble on about these things a little bit. But if you've got any questions, I'm sure I'll be happy to answer now, or Wendy will be fielding them at the end.
Okay, thank you very much. Thank you very much, James. That was really interesting. I'm hoping you've all found that useful. Now is the time for questions. I can't see any at the moment, but if you would like to type them quickly or raise your hand or just click the question, I will be able to come to you. Let me know if there's anything. There's nothing yet. So it might well be that there's nothing that immediately springs to mind. In which case, as James said, we're always happy to support you. We obviously want to make a difference for the lives of vulnerable families, and if there's anything we can do to give you advice or obviously come and work with you, then please do contact us. So I'd just like to take the opportunity to say thank you very much for joining us today. I hope you found it interesting and informative. I'd be interested to know what you think of it actually, so you will get a couple of questions sent to you to say, was it useful? Because obviously we spend time preparing these and presenting them, so if it's not useful, we'd like to know what you would like different, or anything that, any feedback is really useful for us. And once again, please do contact us if there's any information that you want, and thank you very much again for joining us.